The launch of the National Action Alliance for Suicide Prevention brought together an impressive group of our nation's leaders from both the public and private sectors. They chose World Suicide Prevention Day to begin their work together.
Suicide is a personal and national tragedy. We have lost too many people to a very preventable cause of death, and it doesn't have to be this way.
Suicide is a very personal issue for those of us touched directly. It knows no boundaries of age, gender, ethnicity, income, or profession.
It was almost 7 years ago to this day that my wife and I received news that our son had taken his life. There is no way to describe the loss of any child. It is the most challenging thing a parent can go through in this life.
It tests the limits of every human emotion and leaves those left behind questioning every thought, every comment, and every missed opportunity that survivors believe might have prevented the tragic loss.
The effects of suicide run deep. More than 34,000 Americans die by suicide each year. Suicide reaches into all parts of society. Research indicates that there are increased suicide rates among veterans, and suicide rates among service members recently reached historic highs within the Army and Marine Corps.
For the last 5 years, we've seen the suicide rates frankly explode. Before this day is through, we know statistically 5 new soldiers will try to kill themselves.
As Secretary of Defense, my top institutional priority is taking care of those who have borne the burden and paid the price for protecting our nation. That includes doing everything possible to prevent military suicides. It is always a horrible tragedy to see a service member safely off the battlefield, only to lose them to this scourge. If we can, we must, and we will do better.
It really violates our basic warrior ethos. And that ethos is as important as it is direct and simple. We never leave a fallen comrade behind.
Our military has been at war for nearly a decade, the longest war in our history. The post-9/11 campaigns have demanded repeated and extended deployments and exposure to combat, placing unprecedented stresses on our troops, their families, and their support networks. Advances in protective and battlefield medicine have allowed more of our warfighters to survive their wounds, but the survivors often suffer from traumatic brain injury, post-traumatic stress, and other psychological ailments, all factors that can increase the risk of suicide. Troops should know that their careers and security clearances are not at risk when they seek the psychological help they need.
In the Army, we have been working this issue hard, but as proud as we are of what we can accomplish on this one, we neither can nor wish to go it alone.
The National Action Alliance brings together top leaders from the public and private sectors to build on noteworthy achievements in suicide prevention.
Let's get to work, let's roll up our sleeves, let's pull together the very best of ideas, and let's go to a higher plateau where we are actively and anxiously engaged in saving human life.
The National Action Alliance is not just another high-level committee that will hold a few meetings and write a report. It's a public-private collaboration with real responsibility to take the steps needed to accelerate our work in suicide prevention.
We don't have one life to lose in this world, and we're here to bring the full force of our nation's resources to bear on confronting the challenge, breaking the silence, and stopping the pain and suffering.
I'm here today to talk a little bit based on my experience as a survivor of my own suicide attempt. What I remember, though it's been many years, is the utter hopelessness and despair of being in this place where you want to kill yourself.
Roughly 90% of the people who die by suicide suffered from depression or some other diagnosable condition at the time of their death.
While progress has been made in reducing the shame and confusion that unfairly characterizes those living with mental illnesses, a lot remains to be done with regard to this public health issue.
By holding out the light of hope for others, by letting them know we need them, we need our soldiers, We need our family members, our brothers and sisters. We need to preserve the greatest asset, the greatest resource of our country, which are our brothers and sisters, our children and parents.
In everything we do, we must remember that every soldier, sailor, airman, or Marine is part not just of the military, but also of a larger community. Their families, their hometowns, their civilian employers, their places of worship, all must be involved in the solution. To that end, the Alliance's Executive Committee membership is a welcome public-private partnership, including all sectors that need to be involved for a successful nationwide suicide prevention strategy.
We have the ability, we have the tools, we have the knowledge to restore hope and health and healing to those who were challenged like my son was.
It is the ongoing duty of this department to do everything possible to care for those who protect our nation. I'm confident that the insights and efforts of the Alliance will enable us to more effectively fulfill this mission. Thank you.
I have said on many occasions like this that those who do this work on the side of angels.